I think that they might feel that to raise the issue might be slightly pejorative and may stigmatise the parents. I think they might be quite nervous of the response that they're going to get back. So if parents feel insulted, parents may deny or downplay the risk for their infant, and they might just not know where to go once that happens. I also think that they may be concerned about how they communicate the obesity risk, so what to say, how to raise the issue. I think there's communication training needs possibly within some of the health professionals. And finally, I think probably in terms of infancy, I think probably the most critical thing is that we don't really have a lot of interventions. So if you raise the issue about something being wrong, really you, in a parent or a client's mind, really you ought to be offering something in return. And actually we don't have some lovely bespoke package we can take off the shelf. So I think they might be worried about doing it because they can't actually really say this will definitely help or that will definitely help. It's an approach that's actually sort of, I think health authorities are actually starting to use, and obviously health visitors are being trained, and it's a way in which we might talk to parents about a particular issue, but instead of raising the issue and then giving advice, it's about trying to hear and work with where the person is at in terms of where they want to change. And actually focusing on what the parent's saying rather than what's actually going on in your head when you hear something. For example, if you look at a food diary, you might have lots of things that come up in your mind about what that parent is and isn't doing right, but actually you need to kind of work through that with the parent and get them thinking about what might work and what doesn't work. At the end of the day, I think most parents want the best for their children, and at the end of the day I actually think quite a lot of parents do know what they need to do, but actually trying to help them do that for themselves is much more difficult.